I just want to emphasize the difficulty of even suggesting today that we are at a point where we can put together even minimally adequate decision support tools. We say as an oncology community that we rely on clinical trials. They help us, absolutely do. I'm not debating that. I'm not debating that gives us information about drugs, about their safety, about their efficacy. But the reality is, let's be crystal clear. Clinical trials do not represent the patient we see in the community, and that's well known. And I mean, increasingly, they don't represent the people in the community. Age, and in particular comorbidities, are simply not adequately represented. And then you get into this issue, which is increasingly palpable, of cancer as a chronic illness. So, okay, we are not talking about first line, second line. Are we talking about third line? Are we talking about fourth line? Are we talking about resistant patients? Are we talking about patients that may have responded, didn't respond? The complexity is massive. Clinical trial data do not help. And in general, clinical trials are designed for a purpose that does not relate to what I'm discussing. So you want to get a drug approved, you design a trial that lets you get the drug approved, homogeneous population. What's wrong with that? Nothing. But how do we use in the community? Who is going to pay for that? Who is going to organize it? No one. Cooperative groups, NCI cooperative groups, a little bit, not much. And actually, you're going to see a lot more, and you have seen a lot more of these pragmatic trials done outside of this country. That is a problem. That's a massive problem moving forward. So we need to come up with a structure, somehow a way of looking at these questions, addressing them. What about cancer as a chronic illness? What about sequential versus combination therapy? And of course, all of this going to include questions of cost. We've got to have a dedicated, robust commitment by someone. I could argue it could be the NIH, the NCI, to focus on, let's figure out a way with dealing with decision support as we move forward. Maybe AI can be a partner here. Maybe AI can help with this. Maybe real world data that we get from databases, if we shared, can answer these questions for the doctor seeing that patient today, who's not an expert in the field. Patient with a comorbidity, 75 years old, you want to continue therapy. What's optimal therapy? Where are they going to get that help? We need, as a society, and certainly as an oncology community, to start to focus on these issues. And I thank you very much for your attention.